Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode of Health Watch. I am Angela Mweze. Prostate cancer has become a public health concern. It has emerged as the most common cancer among men, especially those of African descent, and it is second most common cause of cancer deaths in men. This increasing prevalence is primarily due to the increasing cases occurring in younger men. While over 1.1 million cases was recorded globally in 2012, the disease accounted for about 8% of all new cancer cases worldwide and 15% of cancer cases in men. The fascinating fact about the cancer is that it is more common in men of African descent and men of mixed race compared to Caucasian and Asians. The lowest yearly incident rates are seen in Asia, while the highest incident is seen in North America and the Scandinavian countries. In Nigeria, prostate cancer is most commonly diagnosed malignancy among men, and some reports suggest that more than 10 men die every day in Nigeria as a result of this cancer. It is estimated that 1/3 of the cases of prostate cancer can be prevented, and another third can be cured if detected early through screening. Even though there has not been a consensus regards guidelines for prostate cancer screening, large population studies have shown increased survival benefits in the early treatment of prostate cancer following screening. There is also evidence that the recent decline in cancer mortality in several countries was as a result of screening and early detection. The most troubling aspect of prostate cancer in Nigeria is the very little awareness. Virtually every year, there is so much talks, information, and even government intervention among women-related cancer like breast cancer and cervical cancer, but very little is said or done about prostate cancer, and a significant number of men are dying silently, even when it can be conquered by early detection, like other types of cancer. On the program today, we shall be learning about prostate cancer. And because there is little information available to the public, please tell your friends, especially of the male gender, to tune into ACNN right now. My guest on the program is Dr. Kenneth Onyejekwe. He's a Senior Registrar, General Surgery, University of Abuja Teaching Hospital. You're welcome to the program, sir.
Thank you, Angela.
Let me just invite my viewers. And for questions, you can send in, remember, you can send in your question, advert placement, or inquiry on how to sponsor this program to the contact shown on your screen. Thank you very much for coming on the program, sir. It's good to have you.
Thank you.
And I was excited the first time I called you, and I just said, oh, come and talk to us about this. And you just went ahead and sent a photo and all the explanations. So it's really good to have you.
Thank you.
And to finally have you here. So we're talking prostate cancer, obviously. But let's do a general knowledge of what cancer is. When you think of cancer, it's a God forbid state. The next statement that comes from cancer is God forbid, God forbid it. But what is cancer in general before we start with the prostate?
Thank you.
Sir?
The cancer can be, described as an abnormal tissue growth.
Okay.
That grows when cells grow beyond other cells.
Okay.
Even when the stimulus for growth has been withdrawn. So you have the excessive proliferation of a line of tissue or cells beyond that of other neighboring tissues or cells after the withdrawal of the neurotrophic factor that causes their growth.
Okay.
If to bring it down to the lay understanding, I'll just use an example. If I have a knife cut and it creates a wound, it creates a defect. The body is such that healing begins immediately after an injury, and all these things take place as a result of cellular signaling from vasoconstriction to the inflammatory phase down to the proliferative phase, the cells within the area of tissue loss have a way of getting signals.
Okay.
Blood vessels have a way of getting signals to grow into the damaged tissue, to send in cells that are mop up inflammatory cells, and then cell growth goes on to fill up that defect. And when the cells fill up the defect, they get another information that stops them from proliferating.
Okay.
And so they get to the level of normal skin, and so the normal skin covers the defect, through epithelial covering. Now, but in neoplasia, in cancers, some cells lose the ability to listen and obey instructions of proliferation.
Okay.
And so they go haywire and start growing and growing and growing abnormally. So that is what happens.
Okay, so in other words, normally when you have a wound,
Yes.
the process is, after some time, when everything is normal,
Yes.
there's a factor that tells the body, okay, it's okay, we are
Exactly.
fine. But now, when the factor is being sent and it's saying stop,
Yes.
the body doesn't stop.
Exactly.
And it keeps.
Yes.
Okay.
So, and then in tissues and organs in the body where there is no injury, the cells of the body replicate.
Okay.
Yeah, so, and then there's what we call cell division, mitosis, that produces new cells. So most of the organs in the body do that. And so there are also signaling pathways that control proliferation of cells.
Okay.
So when the critical steps are lost, there are genes that are necessary for the regulation of proliferation.
Okay.
And so when these genes go haywire, when they lose their ability to control the cell cycle, cancer comes off. And then again, there are cells that are responsible for inducing death in senescent cells in the body, the cells that have grown old. Yes, they have been programmed. We call them apoptosis. They've been programmed to die, shed off. An example can be seen on the skin. Sometimes some individuals have some scaling off of the epithelium of the skin. These are some physical examples. New cells are coming beneath the old conified layer of the skin, and so new ones have to come up. The old one have to be shed off. So there are cells responsible. There are signaling pathways, gene products responsible for the cell cycle, cell division, multiplication, regulation. So when they lose their function, then cancers come in.
All right.
So cancers occur.
Okay, so when this cell is just proliferating and doesn't have control, can't it just grow and don't cause any problem?
Now,
why is it not causing problem? That's just me thinking.
Yes. That's the right way to think. The problem is that because it is now a mutant cell, because it has become abnormal, it causes several problems.
Okay.
The first problem is localized. Okay, because it's growing faster.
Okay.
It absorbs the nutrition, the blood vessels. It acquires new blood vessels aggressively, more than the native normal tissues.
Okay.
So normal tissues are denied nutrients. And now because of its growth in size, it causes some physical pressure damage to nearby cells. Okay. It can erode into nearby organs. It can have, if there's a cancer in the rectum, it can erode into the bladder. In the women, it can erode into the vagina, and the woman will be leaking feces from the vagina. Yes, if it's in the rectum, in men, it can erode into the bladder, you're passing feces in the blood through the urine. So these are local factors, problems that it can cause. It can cause obstruction of other luminal organs and structures in the body.
Okay.
Then it can spread. These abnormal cells can spread to distant parts of the body, and they maintain their mode of proliferation in distant organs. So we call it a metastasis. And so when they do that, they begin to cause malfunction in the organs they have gone to and begin to proliferate in those regions. In the brain, they can cause seizures in the brain. In the lungs, they can cause difficulty with respiration. They can induce the collection of excessive fluid within the pleural space. We call it malignant pleural effusion. So all that, they can metastasize to the liver, and cause a distortion in the function of the liver.
Of the liver.
Yes, blockage of the intrahepatic biliary channels and everything. So these are the problems with cancer.
So the problem with the cancer is the growth is invading other areas that it's not supposed to invade and creating a world, kind of a world of its own, and trying to survive on its own as well, and at the same time being injurious
and disastrous for the patient.
And the patient. Yes. Now I think this is one of the clearest examples of, a clear explanation of the concept of cancer and why it is a problem. Okay. All right. So, prostate cancer. Now, wherever the prostate is, let's know what prostate cancer is, and of course, we need to, know what the prostate is, and that should be what would inform the cancer of that place. Okay.
Thank you. The prostate gland is a very important gland that is found only in men.
Okay.
So there is no prostate gland in women.
Okay.
Now, it serves a very important function for reproduction. The seminal vesicles are just located behind the prostate gland.
Okay.
And then the secretions from the seminal vesicles pass through the gland.
Okay.
It contains very important nutrients. It adds very important nutritious factors to semen.
Okay.
And it helps also to liquefy the semen and give nutrients to the sperm cells. Now, from the picture on the screen, the kidneys are in the urologic. This is the picture of the urologic system.
Okay.
The two kidneys are being shaped up the upper lateral ends of the picture, and then from the kidneys, the ureters drain urine to the bladder.
Okay, that's
Yes.
the two tubes.
Descending tubes
Okay.
laterally from the kidneys drain urine to the bladder. And just below the bladder, before the penis, is the prostate gland.
Okay.
So it hugs the neck of
the
the bladder.
Of the bladder. Okay.
So urine passes through the prostatic urethra. Because after the bladder, the urethra takes off to the penis.
Okay.
And so that urethra has to pass through the bladder neck and then the prostate before it gets to the penis.
So the prostate is just that organ line just underneath the
Yes.
pear-shaped line just underneath the bladder there.
The bladder, yeah.
Okay.
Yes.
Okay. Now, so the function.
Yes, it serves nutritive functions for the male reproductive system.
All right.
Very important.
Very important. Okay.
Yes, for the functions of normal male sperms.
Okay.
Yeah.
Okay, so it gives it the nutrients that
nutrients,
it
yes,
has.
and also helps to produce factors that liquefy the semen after ejaculation.
Okay, so it plays a vital role then.
It's very important role.
Okay, so when it's cancerous, what?
Now, what happens with the prostate gland is that with age, it increases in size.
Okay.
And it can cause symptoms as a result of the increase in size.
All right.
After the age of 30, usually every decade it increases in size. Okay, every 10 years, So
that's natural for every man.
Natural for every man.
Okay.
So some men live and die without having any problems with the prostate gland.
Okay.
And some others develop certain problems as a result of that increase in size. So they begin to have what we call the lower urinary tract symptoms.
Okay.
The prostate grows big and begins to obstruct the flow of urine from the bladder. So they have the symptoms, lower urinary tract symptoms, which I will elucidate later.
Okay.
Now, for some men, they don't have that benign pathology, which we call the benign prostatic enlargement. They go on to have abnormal growth of cells within the prostate gland, which could be adenocarcinomas, epithelial cell tumors, or sarcomas of the prostate gland. And so they, when these genes that regulate cell proliferation lose their function, are mutated within the gland, they have abnormal proliferation. And so we say someone has a prostate cancer. Now, some of these patients may be without symptoms, and some of them may have the lower urinary tract symptoms. So these lower urinary tract symptoms include hesitancy. You know, a man goes to urinate, and the urine takes a lot of time to come. And so because it takes time to come, the man begins to strain to push the urine out. And then the urine, while flowing, does not flow the normal way it is supposed to flow. You know, children like playing with urine, boys. They like competing with their urinary stream. Let me see, your urine will get there. So I see urine, it comes out, but with a very poor stream. And sometimes, as it's coming, it cuts. The man has to strain again to make the urine to flow. At the end of urination, the patient will feel as if the urine in his body has not finished.
Still feeling a bit pressed.
Yes, still feeling pressed. And then urine is supposed to cut at the end of micturition, you know, supposed to stop. But theirs will not stop. You're still having what we call the terminal dribbling. To still be dribbling, and as they are putting their male organ back to their trouser, is staining their underclothes. Yeah, now that is one, we call them the voiding symptoms. Then the other ones are the storage symptoms. These other symptoms occur with features of urgency. So, you know, a normal human is supposed to hold urine to a reasonable extent. You know, but a situation where you feel like passing urine, you have the urge, and before, you know, you can't hold it because the whole bladder, the whole system is irritable. There is, and then urge incontinence. Before they get to the toilet, urine begins to flow out. They also have increased frequency of urination. Yeah, some of these
urgency
symptoms.
for urination, frequency,
urge incontinence, and then they have nocturia. Some of them urinate about 5 to 10 times in the night. But in the daytime, the frequency of micturition for some can be less than, you know, an hour. So every less than an hour, they are always going to the toilet to ease themselves. And it causes embarrassment for their social life. Such men will always look for the convenience anywhere they get into. If it's in the church, they would like to sit near the convenience and all that. So everywhere, it causes a social embarrassment. Some of them will go on to have hematuria and see blood in their urine. Even though patients who do not have cancer can have that, but it's also a symptom. But more in benign prostatic pathology. And then they can go on to have, when there is a metastasis or spread of the cancer to the bones of the back or lower back, they begin to complain of low back pain. And as the metastasis and the bones progress, the patients can begin to have symptoms of difficulty in walking. And at a point not be able to walk again.
All related to prostate cancer?
Yes, all related to prostate cancer. So it's a disease that is quite dangerous in men, and is better prevented than acquired or being treated. You know, so that is the nature of prostate cancer.
So this symptoms, that is the constant urge to urinate, and when you have an enlarged prostate, won't you have similar symptoms, or is only peculiar to when you have cancer, or if you have an enlarged prostate? Because it's not all the time that you have an enlarged prostate that means it's cancer. It happens with age, which is supposed to be normal. Do you still have those kind of symptoms as well?
Yes, for benign prostatic enlargement, they have only this lower urinary tract symptoms.
Okay.
Without a focus of cancer within the prostate.
Okay.
So they have these features. And that is why, but what happens is that you cannot tell which is which until you have taken a history and examined the patient.
Okay.
And they've done a screening for the patient and investigations. Then you'll be able to classify. Say, okay, you are having a benign prostatic enlargement and you are having a cancer of the prostate.
Oh.
Yes. So, but most symptomatic prostate conditions are common for both the benign condition and the cancerous condition. But as I said earlier, there are men who have the cancer without having all these symptoms.
Oh, really?
Yeah.
Oh, okay.
So that is why screening is very important. After the age of 40, some say 45, it's good for young men to visit their doctors, to have a check of their prostate, and then to do a prostate-specific antigen to check. Yes, it's a screening test for the prostate.
So just the same way women go for cervical test, you go for breast screening. It's important for men to also, over 40, 45.
Yeah.
Advisable, maybe 40, maybe it should be okay for screening for men.
Yeah.
So now, when okay, so just to I want to wrap that properly. So when you have these symptoms, it's important to go to the doctor when you note. Of course, if you're over 40, because most of the things I've read say 50 and above. You should, if you notice any of these symptoms, you know, it's important to go and see a doctor so that they can do early screening for you. But there's a question that bothers me. There's a question I want to ask, and this thing keeps coming up all the time. There's this, it's everywhere. You know, cancer is more intense in men of African descent, black skin, without wanting to use that word black skin, but men of African descent than their counterpart from other race. It seems to keep occurring, and I'm seeing it again in this case of prostate cancer. That's just reading by the research that I saw around. What could be responsible? Is it just there's something wrong with us, with our skin? I mean, not having much word to use to describe it.
Yes, there are diverse reports of the incidence of cancers of the prostate, depending on geographic location. However, before it's been always known that the American continent, North America, has high incidence of cancers. But among them too, the African Americans also are reported to have high incidence rates of cancer of the prostate. But they have, like I forgot to mention, that cancer of the prostate can be indolent or aggressive.
Okay.
Most are indolent. Very few are aggressive cancers. That can.
You mean indolent?
Indolent means they are very gentle, very calm, doesn't spread too fast, doesn't kill too fast, and allows you some time, to live more. Okay, and then the aggressive ones pursue a more rapid course. They proliferate faster, they metastasize early, and they are more dangerous than the indolent type. So the African Americans have been noted to have more of the aggressive type. And then it's been noted that in Africa and in third world, there's been rising incidence of cancer of the prostate. And some people attribute it to increasing awareness and increasing screening strategies.
Okay, that's for the Western world.
Yes.
Okay.
Yeah, even for us here in Africa, increasing screening strategies in the Western world, because there's been rapid increase in diagnosis in the Western world. And some people attribute that to, of course, screening facilities, availability of screening facilities, and then I will also say the health services utilization behavior of the people in advanced nations of the world, where they, from childhood, it's been a lifestyle.
Yeah, okay.
They've been conditioned to always go to the hospital and check up themselves. But in this part of the world, you know, it's so difficult. And that is why the cases that we see in hospital are usually advanced cases.
Oh, right. So people come when they are really bad.
Yes, when they are very bad. So the cases you are even talking about, increased incidence in Africa, in Nigeria, are really late-stage presentations. When they are about to die, when there is no other thing, they come to the hospital. So, but at the early stage, which is the ideal time to come to the hospital for screening, our people do not come.
Do you think it has anything to do with the culture, the mindset of the man? Oh, I'm a man, why should I go around? Like, if you go everywhere, women, it's like, come and screen for this. Women are just going freely everywhere. But I don't know if you want to tell my dad to go and start screening for prostate. I don't know how he's going to take it.
It has a lot of issues, cultural. A man is powerful. A man shouldn't be sick. You know, some people have actually said that they are well until they collapse at home. So this is a problem, cultural issues, and then, well, I would say poverty.
Okay.
When they think of going to the hospital, they think about money.
Money.
There's no health insurance. Out-of-pocket payment is a problem for the struggling man who is the head of the family. So he would rather take care of the family, provide for their needs, than spending such money on evaluating himself.
Yeah.
So these are some of the problems.
But the issue of the man not going to the hospital isn't helping, because there may be somebody watching now and just thinking that's what they're talking, that's their own talk. But really it's important for men really don't take care of themselves a lot. I think they give up everything for the family and forget that they're also part of the family and should be taken care of. So the men should also look after themselves, just like we've talked about the symptoms. There's somebody watching and you notice that your frequent urination, or when you urinate, you find out that you don't empty completely. There's still, as if there's something still remaining. If you notice some of these symptoms, it's good to just slide. I mean, most of the doctors are men too, so it's easy to walk into the hospital and ask for, you know, some form of examination to be sure that so that it doesn't present itself at a late stage. Now, we'll go on a quick break, and when we come back, we want to talk about if there's any form prevention, because every cancer, there's always this line of things to do to prevent cancer from happening. But let's see if prostate takes the same route, and then we'll look at treatment, you know, as well, and talk a little bit more on the perception in the church. What role should the church be playing to help in getting this information out there? So we'll be right back, viewers.
Worthy by design. On this show, we focus on the journey from girlhood to womanhood and everything in between. You are worthy by design.
Welcome back, viewers. Before we went on the break, we were discussing prostate cancer, and my guest is still Dr. Kenneth Onyejekwe. He's the Senior Registrar, General Surgery, University of Abuja Teaching Hospital. And don't forget, you can send in your questions, advert placement, or inquiry on how to sponsor this program to the contact showing on your screen. So thank you very much, sir. Let me just, I still think this is the best explanation on cancer, and it's interesting that it's prostate cancer we're talking about. So thank you very much, sir.
You're welcome.
Okay, so we want to talk about the causes of prostate cancer. Something must have been responsible for that, to happen. So what could be responsible for?
Yeah, thank you very much. There's been several investigations on the etiology, the cause of prostate cancer. And as at now, no one has really held any particular thing to say this is the cause. But we know that as long as you have a testis, as long as there is the presence of the testis, is a male with advanced age, these are some of the risk factors for the causation of prostate cancer. Others are genetic abnormalities, genetic mutations, as I mentioned earlier. And then others could run in families. It could be familial cancers of the prostate. And men who do not have family histories usually present about 50 years of age, especially Caucasians, but black men with a family history and others too usually present much earlier. Disease. So, and then the adoption of westernized diets has been found to have a relationship. Processed food, saturated fat intake. In fact, some of these excessive fat, red meat consumption causes the production of so much fat in the body that are acted upon by reactive oxygen species. So in the course of those reactions, mutations take place. Genetic mutations, genetic injuries take place, DNA damages take place that may lead to the cancers. Yes, excess consumption of alcohol.
Alcohol seems to come out for every
cancer. Yes, and then the lack of intake of flavonoids, fresh fruits, tomatoes, vegetables, have been seen to be etiologic factors in the causation of the cancers of the prostate. So these are some of the problems that cause cancer that are related. There are common variables seen in patients who have cancers of the prostate.
So number one, if it could be genetic. So if your parents, if any of your parents had it, it's most likely that you would have it. So it's good to, go for early screening, just like we talked about, to ensure that you're good. Now, in the causes, because I said we're going to do a bit on the myths, what people believe. It will amaze you. I know, you're in the hospital. I don't know what your experience is like. But some people say if you don't have constant sexual intercourse, because that's some of the story they tell some of the young guys, that hey, if you don't have constant sex, then you're not removing sperm, so you're most likely going to have a swollen prostate. Is there anything like truth in that statement?
No, there is no truth in that statement. Yes, and sexual activity, the frequency of sexual activity has not been related to causation of cancer of the prostate. So these are just the myths that hold no sway. In medical practice, not true.
It's not true.
Yes.
So
the presence of the prostate, whether you have sex or not, the presence of the prostate with advancing age is a risk factor for cancer of the prostate. Whether you had led a celibate life or not, or whether you were radically, randy, it has nothing to do with the prostate.
So just in case there's a young guy watching,
yes.
Now the professional has said there is no linkage. So if you're dealing with abstinence, keep doing what you're doing. You're not going to get. You're not at. That's not a risk factor for prostate cancer. You're fine. So if you choose that, you're fine.
And if you abstain, you stay free from the other consequences. That can cause you lower urinary tract symptoms. Like urethritis, gonococcal urethritis, and all those that can later cause strictures in the urethra to make it impossible for a man to urinate and have all those features I mentioned earlier. So the earlier, the better. you abstain is the best for the patient.
And there's no linkage between sexually transmitted disease and prostate cancer.
That's for
so
now.
far as for
No,
now, there's no
yes,
linkage.
there's no linkage.
Okay, it's just on its own.
Yes.
It's enlarged and.
Yes.
Okay, so we've looked at the causes. That is, if you're a man, that predisposes you already
Exactly.
to, you know, prostate cancer. Then if you have it in a family, I'm just trying to run through. If you have it in your family, then
Genetic
you know,
mutations,
genetic mutations and all
advancing age.
Advancing age.
Yes.
So, but also because we have adopted lifestyle that is alien, or maybe too much fat in the food,
Too much fat.
and most food have been processed. Because I read one of the studies that was published, I can't remember the paper that published it now, to say that all processed meats, you know, they lead you, they are risk factors to cancer.
Yeah.
All of them, the sausages, the bacon, all of them, they're all risk factors to cancer. That you know, so because we've adopted all of that, it's predisposes you, but nobody understands the linkage up to now.
That's what I said. You know, some of these are red meats, saturated fat, and that's what they contain.
Okay.
So reactions take place in the body.
Cellular.
Cellular damages. DNA damages take place when reactive oxygen species act on these saturated fats.
Okay.
And so they could cause breakages, mutations within the genes, and then the regulators of cell cycle will lose their capability of regulating cellular proliferation. And they also, some lose their function of inducing apoptosis, inducing the cells to die. So because when a cell in the body has lived too long, it should be programmed to die, to exit from the body. Okay? And so when all these genes responsible for these processes are mutated, are damaged, then abnormal proliferation stays cause.
Okay. So I'm not thinking in my head, is it possible for people, young boys in their teenage age, to ever, for whatever reason, get prostate cancer even at that age? Because of course medically you can't say there's impossibility, because there's always one in. And if any of such would happen, why do you think such would happen? Or
actually, prostate cancer is a disease for senior men.
Senior men, okay.
Okay, but we've also seen men about 40 coming down with very advanced cases in Nigeria and some of our teaching hospitals. Some of those people may have been those whose fathers who have a familial, problem, of this cancer in their families. Because there are a cluster of genes that cause particular cancer, so a group of cancers. There are particular gene mutations that control cellular growth in more than one organ in the body, that control the cell cycle. So you can find somebody's mother or somebody's father died of prostate cancer, and then the daughter or the grandchild will begin to have breast cancer. So these are problems around the same locus of genes that are mutated. So they're manifesting in various organs.
Okay.
Yes. Yeah. So some people who have colon cancer, their parents had colon cancer, can't come down with prostate cancer. They can come down with breast cancer. That is for a layman understanding. Yes, but cancer of the prostate specifically is for senior men, but it's not for adolescents and young children.
Okay.
Yes.
Okay. So we should be assured that. Okay, let's talk on the screening. That's delving into prevention now. But the screening, what does it entail? Because I'm thinking of one of the viewers watching and thinking, if I go to the hospital, before, when women were asked to screen for cervical cancer, one of the complaints is that it was too invasive, it was uncomfortable, and until they started telling women, oh no, this is what it's like. So what does the screening entail for the men, who and how common is it here in Nigeria?
Well, the screening is both clinical and laboratory. So when you come, we take a history. You see a doctor, he asks you some questions. okay, you've come, you want to check your prostate. Is there any lower urinary tract symptom? Is there any family history of cancer of the prostate or other cancers in your family? And, and then after the history, the doctor will examine the prostate. Examining the prostate can be felt through the rectum, through the anus.
Okay.
So the man's privacy has to be invaded.
All right.
But courteously, he'll be lying on the couch and screened, and the doctor and his assistant will examine him with well lubricated gloves so it doesn't cause pain.
Okay.
So the patient is told to lie on the left side and then to push the waist to the bed, to the edge of the bed and fold the limbs. And the doctor will insert a well lubricated index finger, gloved index finger into the rectum. So by the time you do that, you begin to feel the nature of the consistency of the prostate.
Okay.
You feel whether the outline is regular, is smooth, is even. And then to see if there are nodules on that prostate. The very early prostates will not have a nodule on the surface. They will have, the prostate is in shells, in layers, from the inner layer to the outer layer. And it has zones, so the peripheral zone is where we feel with our fingers, which is commonly affected by the cancer of the prostate.
Okay.
So when we feel the prostate from there, we'll be able to evaluate whether the consistency is firm in normal glands, whether it is hard and nodular.
Okay.
Yeah, so when it is hard and nodular, we pick a nodule, we know that something is wrong.
It's wrong. Okay.
We also check whether the rectus, that is the rectum, that is overlying it, is mobile.
Okay.
If there is any nodule, it invades the rectal wall, and so that area would not be mobile again.
Okay.
So this is the part of the clinical evaluation.
Okay.
Then at the end of that, we send you for a screening, the prostate-specific antigen, PSA.
Okay.
Yes, it is very useful in screening.
Okay.
Normal glands usually produce low amounts of that antigen, PSA, and should be between 0 to 4 nanograms per mil. When it's above 12, usually diagnostic of cancer. But the most important diagnostic evaluation we do is the prostate biopsy.
Okay.
So we cut a tissue from the prostate. Because it is important to note that even though the PSA is used for screening, it is not very specific. It can be normal, it can be within the normal range, but the patient has a cancer. Because there are cancers of the prostate that does not elaborate that PSA, like a sarcoma of the prostate. So the levels remain normal. But the best evaluation for cancer of the prostate is a biopsy. But for screening, PSA.
PSA, okay.
Yes.
Okay.
Yes.
So it's not a complex process
it is
like
not.
that for men. It's really easy.
Yes, it is easy.
Okay.
It is easy. Men should just come to the clinic.
Just come and if you notice the symptoms we talked about, just walk to the hospital and then go for a screening.
Yes.
And it's overdone, so they let you know.
Yes.
Now treatment. What are the treatments available?
Yeah.
I might not go in details of treatment, but
for the layman, the treatment falls into several categories. For early stage disease and for late stage disease. There are also the early stage disease, we aim for cure.
Okay.
Because the cancer is confined within the prostate. It has not left the prostate gland.
Okay.
So the aim is cure using various modalities, including radical surgeries, to remove the prostate and surrounding organs within the pelvis. Now, for the late presentation, which is usually what we have in this part of the country, in the world, where our patients present very late with metastases and all the complications, The treatment is usually palliative, and it has to do with manipulation of the hormones that are responsible for the growth of the prostate. Remember I said one of the etiology or risk factor is having a testis. Now the testis produce testosterone, and this all help in the growth of the prostate gland. So hormonal manipulation, surgeries, and depending on the pattern, there are diverse patterns of presentation. There are men who have prostate cancer and who have occluded urinary passage, as I said, all the lower urinary tract symptoms. So you take care of that, you channelize their urine, you can do a transurethral resection or transurethral channelization of the gland, to enable, to allow them to urinate without difficulties. And then we do hormonal manipulation. So we can use drugs.
Okay.
We can use surgeries. For example, the commonest surgery we do is removal of both testes. And so that reduces the level of testosterone.
But that's putting the man in trouble.
Yes, but it's a senior man, so we begin to weigh the options and the cost and complications of the hormonal treatments and manipulations that are very expensive and with a lot of side effects. Yeah, so that is what we do. When the man comes, you are told this is what we'll do for you. You have to take surgical or sometimes a combination of both.
Okay, but after
so we do maximum androgen blockade. Both removal of the testes and combination of drugs to ablate the hormones that increase the production of the steroids responsible for the growth of the prostate gland. So that is what basically what we do.
So which means after a surgery, you can't return to your normal sex life? Is that what?
Yes.
Or you have a reduced libido, it might not be libido, it might not be as much
libido and all that. So these are some of the complications. In fact, for most of them who are already sick and symptomatic, sex is no longer an issue.
An issue at that time.
Yes, and that is where their wives come in. Their wives need to understand that their husbands are in serious problem. Yes, most of them are battling with metastasis, with bone pains, low back pain, battling with metastasis to the chest, coughing out blood, weight loss, and all that. So it could be terrible for anyone involved.
Okay, so which means a lot of education should go out for men to screen early. Because if detected early, don't wait until you're 60 and then 70, then you're trying to do a screening. You can do it earlier, 45, 50, to know that, if it's early enough, for early detection, then you can start your treatment. It's not manly to die of prostate cancer. There's nothing manly about it. We've completely run out of time because I wanted to talk about how the church, but I think it still has more to do with awareness.
Yeah, the Anglican theology is a balanced theology.
Yeah.
The Anglican church is not the church where the pastors will keep you with the cancer and be praying for you. The church teaches people that Jesus Christ is the foundation of all professions and is the head of medical science, is the origin of medical knowledge. So men should seek care in hospitals early enough before they get complicated. Early visitation, screening, that we call it primary prevention. The church should
talk about it.
Yes, an advocate for primary prevention. There is nothing like being super spiritual and then telling you that just like we're having in COVID-19. We see some Anglicans on Facebook, when they see a bishop on face masks, they say, oh, the Lord has left the church. The Lord has not left the church. We are in a phase. And he cannot leave the church. Jesus is the author of the face mask. He just like he asked Noah to design the ark. That is how he asked the scientists to design the face mask in times for moments like this. And so people should seek proper care.
Yeah.
Yes. So science is godly.
It's godly. It's not.
It
It's
is
not.
not
It's not
satanic.
devilish.
It's
It's
no.
satanic, as people put it down
Yes.
there.
So the church should be an advocate for primary prevention.
Primary prevention.
Yes.
Okay. So for those that are watching me, please in your churches talk about this. Tell the men to go for prostate screening, because I hear a lot about breast screening, cervical cancer, everything women, but I've never heard anybody come and say, "Oh, the men, you need to check, go for screening if you're over this age."
Yeah.
But I think it should start, and it should start strongly,
Yes.
so that we can also save our men. Because unfortunately, sometimes men don't really know how to take care of themselves unless they are loved ones.
Yes.
I will thank you very much, Dr. Kenneth, for coming on the program. I think I've really I enjoyed the talk on this prostate cancer, and I believe our viewers have learned a lot, and more men will go in for testing. Thank you very much for coming on the program.
You're welcome.
Thank you so much.
Thank you.
Thank you. All right, viewers. So for the past 45 minutes or so, we've been talking on prostate cancer, and I can't say it over. I can't say it enough. Please go for screening if you're over 45, between the age of 45. If you're over 45, please go for screening and check yourself. Take care of yourself. And look, medical science is godly. It's not satanic. So God gives all the wisdom for every profession we have. Thank you very much. I've been speaking to Dr. Kenneth Onyojokwe. He is a senior registrar, general surgery at the University Teaching Hospital, Abuja. Thank you very much for joining me on the program. I'll see you next week. My name is Angela Weze. Goodbye.